Jason, you're a big believer in making sure that everybody has access to health care, and especially if it's affordable and convenient. Tell us a little bit about the mission of your company, Teladoc.
Well, we think virtual care is the great equalizer in healthcare, and it's our mission to transform how people get care to make it more convenient, higher quality, and lower cost. And we've been doing that now. I've been at the company for 10 years. We'll do almost 4 million virtual care visits this year all around the world to do exactly that.
Well, the great thing about telemedicine is that you're providing health care for people who live in areas where they may not have access to a doctor or really good doctors. But what about on the cost side? I mean, to what extent is Teladoc helping to bring down healthcare costs in the process?
Well, by eliminating the physical barriers to getting care, it also brings down the cost of just the infrastructure necessary to deliver that care. Technology facilitates the access, and we're able to use little slices of doctor's time that otherwise would go unused. And by doing that, we can bring down the cost of care, getting the right care to the consumer at the time when they need it in a really efficient manner. So it's really, I've been in healthcare almost my whole career. It's the first time I've had the opportunity to work on something that's a win for doctors, a win for the payers of healthcare, and a win for the patients.
We've seen so many business leaders who believe that they can and should do a better job in addressing the needs of society, dealing with some of the issues, social issues. What's your take on that kind of leadership?
I think it's essential today. I think people want to be inspired both in the workforce and by the companies who they work with. I went into healthcare to begin with because I wanted to make a difference. I wanted to do something where I thought I could make an impact on society, on people's lives. There was clearly a huge need. There still is a huge need. Our team of people really embraces that. I think it's leaders' responsibility to lead, to really act in a way that is inspiring to people, socially responsible, and goes beyond just delivering bottom line results.
And so I guess it was along those same lines that you're talking about responding to be socially responsible that you announced the creation of the first ever patient safety organization, and this is for virtual care delivery. It's never been done before. What was your goal? Why did you do this?
Well, quality is really foundational for us, and the opportunity to establish a patient safety organization that collects data about virtual care and collaborate with the rest of the healthcare system to be able to measure quality and really define quality for virtual care was very attractive to us. One of the big barriers to virtual care adoption is a question about, is this going to be high quality care that really resolves my needs? And we know that's true. This is a way for us to help demonstrate that.
You know, you're an entrepreneur, so you're thinking directly of solving problems and solving society's problems, but a lot of bigger companies, Fortune 500 companies, have so many other issues to deal with, and they're not as focused on this stuff, and they get feedback from their employees to take on some of these issues. To what extent do you have employees in your organization that want you to weigh in on some of these social problems?
Oh, absolutely. There's no question. Our employees think of us as if we were a Fortune 500 company in terms of the impact that we can have. So we may not have, thousands and thousands of employees all around the world, only 2,200 at this point, but the impact that we can have with our clients, our social responsibility is just as big as anyone else. In Paradise, California, where the fires were, we work with Blue Shield of California, and one of our team members collaborated with them to come up with an idea because the Paradise Medical Group had gone up in flames. And so those physicians were unable to work, the community was unable to get care, and a member of my team worked with our friends at Blue Shield of California to stand up a virtual care practice for that medical group so that they could get back to work and start taking care of the community there.
So you're here at the Fortune CEO Initiative Conference, where there are a lot of CEOs who are talking about these very same issues. What did you get out of it? Was there any one thing that really stood out for you and maybe influencing your thinking?
Yeah, I think there's no secret that technology is in the hot seat right now, right? The use of data, access to data, and the trust of the consumer are very closely related. And it's good to be among a group of CEOs who are tackling that initiative and recognizing that that's a problem for us. I think transparency is critical, right? And what I heard today was a push for transparency about what we're doing with data, what the technology community is doing, how we're using it, and how it can be for the good of the consumer and not a scary thing.